Hi, I'm Paul Elam with a voice for men and an ear for men. It's time we talked about neonatal genital cutting, genital mutilation, euphemistically called circumcision in the case of males. I will assume you've heard many of the arguments against and supposedly for this practice. I also assume that there are a fair number of MHRAs who don't see this as a men's issue for religious or other reasons. So let me just state some of the basics and allow me to move forward with why AVFM will be making this a dominant issue in our activism. I will also explain why we have already begun that activism in earnest. Let's begin with the pro-neonatal cutting argument that the procedure is a prophylactic measure to prevent the specific problems of urinary tract infections, HIV, human papillomavirus known as HPV, and penile cancer. To be fair and honest, there is some medical research that superficially lends credence to these claims. As we often find with assertions, though, that serve an ideological or financial agenda, when you look at these claims carefully, they unravel and fall apart like the alleged gender wage gap. Let's take these claims one by one and see them each through analysis of the U.S. Library of Medicine at the National Institutes for Health. We will start with urinary tract infections, and I quote, "The actual incidence of urinary tract infections in the first year of life is low. Even a tenfold reduction in infection rates equates to changing the incidence of urinary tract infection from 1 in 100 to 1 in 1,000 male babies. It has been calculated that the rate of urinary tract infection among infant boys with foreskins must equal or exceed 29% for neonatal circumcision to be cost-effective. Conversely, for neonatal circumcision to be cost-neutral, each patient hospitalized for urinary tract infection would need to cost $229,564. In 2004, it is estimated that approximately 1.2 million newborn circumcisions were performed in the United States. The estimated direct cost of these procedures was $1.2 billion, a large sum of healthcare funds that could have been directed toward more effective preventative and therapeutic interventions." Unquote. Now, two things to note here. Good hygiene, which is virtually free and literally risk-free, will prevent urinary tract infections more than neonatal cutting. Also, the $1.2 billion spent on neonatal cutting does not include the profit practitioners make from selling foreskins for stem cells and high-end beauty cream for women. Those foreskins fetch upwards of $400 each. Regarding prevention of HIV, NIH takes a different track, generally supporting the conclusion that adult male circumcision protects against the transmission of HIV. They cite research from Robert C. Bailey and Stephen Moses in the now debunked Orange Farm studies. These studies were harshly critiqued for bias and poor methodology by the organization Doctors Opposing Circumcision with the following statement on the randomized control trials. And I quote, "After the failure of observational studies to show a clear protective effect, circumcision advocates obtained funding from the United States National Institutes of Health to conduct randomized controlled trials, RCTs, in Africa. 3 RCTs to study the value of male circumcision in reducing HIV infection have been conducted in Africa since the publication of the Cochrane Review. The studies were intended to find out if circumcision is an effective intervention to prevent female-to-male HIV infection. An RCT under the supervision of Bertrand Auvert, French circumcision proponent, was carried out in Orange Farm, South Africa. An RCT was carried out in Kenya under the supervision of North American circumcision proponents Robert C. Bailey and Stephen Moses. And an RCT was carried out in Uganda under the supervision of North American circumcision proponent Ronald H. Gray. Dr. Arver has been a circumcision proponent since at least 2003. Professor Moses has been an advocate of circumcision at least since 1994. Professor Bailey has been a circumcision advocate since at least 1998. Unquote. Again, this is a minimum $1.2 billion industry. And with the United Nations and the Gates Foundation pushing for 25 million circumcisions in Africa, no less, we now find those with a financial interest in the cut leading the advocacy for it as a falsely claimed preventer of HIV transmission. The NIH has provided some good investigative information on neonatal cutting. Unfortunately, they've dropped the ball on HIV and the cut. Where it concerns HPV, a known cause of cervical cancer in women, the National Institutes for Health had this to say, quote, "It has long been observed that the prevalence of cervical carcinoma is low where circumcision is widely practiced. This has usually been attributed to a decreased prevalence of HPV on the circumcised penis. However, a recent meta-analysis on HPV and circumcision concluded that the published literature does not support the claim that the procedure reduces risk of genital HPV infection. In conjunction with the advent of an effective female vaccination against HPV prior to the onset of sexual activity, this study suggested that the argument in favor of circumcision as a preventative measure was weak." Unquote. The report went on to say that developing nations with substandard medical care made a much stronger case between genital cutting and the reduction of HPV-caused cervical cancers. It is also noted that these are also countries where the much less damaging and invasive use of vaccines are seldom available. These are informed scientific responses to the supposed pros of neonatal cutting. The negatives are much more concerning. In a partial list, they range from death and disfigurement, excruciating pain, alexithymia, depression, interference with breastfeeding and parental bonding, post-traumatic stress disorder, anxiety disorder, and midlife sexual dysfunction. That is not to mention that the foreskin is a human organ with tens of thousands of nerve endings and the clear purpose of protecting the penile glands throughout a human male's life. Its unnecessary amputation without some justified medical necessity is a barbaric practice being carried out for financial or religious reasons. At the root of this, we must also remember that the procedure was revitalized by religious zealot John Harvey Kellogg, a Seventh-day Adventist who fabricated stories about the procedure being a health issue as a ruse to push an agenda to get boys to stop masturbating. And the most egregious part of it today is that it is inflicted on infants who cannot give consent. At the behest of their parents, they are strapped down to a table and genitally mutilated. Religion aside, most parents don't even know why they are having it done. If anything, it is just to make sure that the son was mutilated like the father. One of the primary objections to addressing this as a men's issue within the MHRM is when some MHRAs come out and say, "I was circumcised and I'm just fine." All I can say is that a man born with one leg will tell you the same thing when he adapts to it. A bird in a cage for 20 years may well feel safe and free. If you have lived your whole life without 75% of the erogenous nerve endings in your penis, you will naturally not know what it would be like had your bodily integrity been respected. The fact that you have been harmed and have become acclimated to it is a pitiful excuse to keep mutilating children. A Voice for Men rejects that false reasoning and has proceeded with the launch of neonatalcutting.com. The site has two purposes. The primary one is to educate expectant parents on the dangers and well-documented ill effects of neonatal cutting. The secondary purpose is to call out the practitioners of this barbaric practice and to make sure that anyone researching their services online knows what they are really up to when they start cutting on their children. We have created a directory there where their practice information is presented. Each listing is linked from an AVFM announcement about that practitioner. So far, we have listed 3 individuals: Dr. Yang Kim, Dr. Timothy C. Gompf, and Dr. Sheldon A. Wise, who killed one of his patients with a neonatal cut. And so far, each one of our articles comes back on the first page of returns on a Google query. They will remain there in perpetuity. We will be adding hundreds, if not thousands, of these mutilators to the list. In fact, if you're an anti-MGM activist and want to help us fill the list faster, please contact me directly through A Voice for Men. I can no longer take any men's human rights activist seriously who turns a blind eye to the savage mutilation of males at the most vulnerable points in their lives. After all, how can we even say we are advocates for men and boys if we are to remain silent to the most fundamental right of bodily integrity? The time for this horrific practice to end is now. Our effort to push for that will be to publicly name and shame doctors, rabbis, and anyone else with an excuse to introduce baby boys to life with the blade of a knife. Thank you for listening, and we'll see you next time.